latest member of our community to succumb to the coronavirus. Our thoughts and our prayers are with them, as well as the families that have been affected by this deadly virus. On Sunday, in my national address, I outlined this government's plan for moving beyond the pandemic. The government has set out a three-phase approach with the goal of ending the merry-go-round of restrictions and getting Bermudians back to work. Tonight, I will highlight key messages from Sunday's address and answer some of your questions and concerns of the pending changes at our borders coming to effect over the coming months. I'm thankful this evening to be joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update to the country on the latest coronavirus test results, vaccination statistics, and other matters from our ministry. And we're also joined by the Chief of Staff for the Bermuda Hospitals Board, Dr. Wesley Miller, and hopefully for question time, Chief Medical Officer. We'll begin our press conference this evening with the Minister of Health. Minister?
Thank you, Premier, and good afternoon, everyone. I begin my remarks today by also offering sincere condolences to everyone who has lost a family member, a friend, a neighbor, or a colleague in circumstances related to the coronavirus. Recently, we have had a number of deaths, and my heart goes out to each and every one of those persons' loved ones and their families who have lost someone during this pandemic. On behalf of the government of Bermuda, I am so very sorry for your loss. We will keep you in our thoughts and our prayers. The Ministry of Health received 512 test results since the last update, and 5 were positive for coronavirus. This gives us a test positivity rate of 1.0. 2 of the new cases are classified as local transmission with known contact, as they are associated with known cases. The additional 3 new cases are classified as under investigation. These cases are amongst residents who, with no currently identified links to either known cases or history of travel in the past 14 days. Additionally, since the last update, there were 13 recoveries and no deaths. There are currently 601 active cases, of which 570 are under public health monitoring and 31 are in hospital, with 8 in critical care. Since March 2020, Bermuda has recorded 2,362 confirmed cases of COVID-19, and out of these, 1,737 persons have recovered, and sadly 24 have succumbed to COVID-19. The 7-day average of our real-time reproduction number is 0.68. Bermuda's country WHO current status remains at community transmission. Our positive cases results are going in the right direction, and so far our recoveries are outpacing the number of positive cases that we report from day to day. However, as I said last week, we are not out of the woods yet. Our current COVID restrictions remain in place in order to reduce the outbreaks in our community, which I know is stressful news to many of you. A lot of us are emotionally and mentally drained from this pandemic and the restrictions, and I urge everyone to please be patient for the next couple of weeks, be extra vigilant, and follow the regulations and guidelines. We are a strong and resilient community, and we will get through this, and it will be all worth it in the end. The more vigilant we are, the faster we will progress. I'm confident that we will continue to pull together as a community to eliminate local transmission and make sufficient progress. We can end restrictions of household mixing and enjoy interacting with our friends and families again. We can also reopen our schools and other facilities and services, and we can dine outdoors. I will now provide an update on our vaccine program. We have completed the 15th full week of vaccinations, which started on the 11th of January, and the report that I'll be producing is up until the 24th of April, 2021. Bermuda has administered a total of 55,319 vaccinations, and that figure rises to 55,904 vaccinations if you include those that were administered on Sunday and Monday. And again, this is extremely excellent news. Of the 55,319 vaccinations administered for the period that we are reporting on, which again ends on April 24th, 53% of those persons were women and 47% were men. Significant progress has been made in vaccinating our population, and especially our most vulnerable. So far to date, 73% of all residents over the age of 65 years have had at least one vaccination, with 62% being totally immunized. Also to date, 50% of our total population has been vaccinated with one dose, and 37% of our population has been fully immunized, namely having had 2 doses. One of the government's primary objectives is to increase the avenues available to members of the public who wish to protect themselves and others by getting vaccinated. With this objective in mind, we are pleased to announce the Close to Home Vaccination Initiative, and that has been established, and we started today at Pennell's Wharf. The outreach program to increase access to COVID-19 vaccines will continue with a ride-through, drive-through, or walk-through venue at Southampton Princess this Thursday, the 29th of April, and Sunday, the 2nd of May at TCD. And both of those times are between the hours of 10 a.m. and 2 p.m. So again, it's Thursday at Southampton Princess between 10 a.m. and 2 p.m. and Sunday at TCD between the hours of 10 a.m. and 2 p.m. The drive-in venue is specifically for persons who have not yet registered for the COVID-19 vaccine, or do not have access to the internet and prefer to register in person, or who have additional questions about the COVID-19 vaccine. As a reminder, the Bermuda College Vaccination Center will continue to open from 9 a.m. until 1 p.m. daily, and those persons are, it's a walk-in facility, so you do not need an appointment. You can just show up and roll up your sleeve. Those persons who have appointments at the College Vaccination Center are asked to attend the old King Edward Memorial Hospital wing or the BHB Vaccination Center to get their vaccinations. And the vaccination hotline will be doing phone follow-up calls to confirm those appointments. Getting vaccinated is something we can do for ourselves, our family, and our community. And many have taken the step to protect themselves and their loved ones. Others are doing their research, listening to the facts, talking with their doctors, and taking the time to decide for themselves and their families. For people who have decided not to get the vaccine, please remember that you still have a role to play in knowing your status. Please make sure that you get tested regularly to be sure that you are not carrying the virus. And you should continue to wear your mask and follow the other public health guidelines. At this time, immunization is our best hope to get our lives back to normal. But all of us, immunized or not, still have a role to play. We are all looking forward to the day when we can go back to our old way of doing things. We are looking beyond the pandemic. I do understand the challenges that many people are facing today. Many families in Bermuda are experiencing real emotional and financial hardships as this pandemic continues and persists. I know it has been said in the past, and it remains true today. We are each other's brothers and we are each other's brothers and sisters keepers. If you can, we should help someone in need. We are a community of family, friends, and colleagues who have supported each other and continue to do so throughout this pandemic. Financial help is still available through the Department of Financial Assistance, and there are helping agencies available to provide support likewise. And there's also the emotional challenge, those persons that need assistance with respect to emotional challenges that they may be facing can call the Emotional Wellbeing Hotline at 534-1111 for support from 5 p.m. to 9 p.m. Monday to Saturday. We are moving forward together through this pandemic. Thank you to each of you who have followed the public health guidelines. They are put in place to protect us all. Thank you to each of you who have decided to get the vaccine. And thank you to each of you who have made a difference in the life of another. We will continue to move forward together. Before I end, I would like to say a special thank you to Dr. Io Olinier, the CMO, Dr. Karika Weldon, Daiwan DeRosa, and Dr. Ramon Arscott for their very informative Facebook Live panel discussion entitled Vaccine Mythbusters Addressing Fears and Concerns. And it was held last Saturday evening, April 24th. And they did a very good job of making it easy for the public to understand vaccines better. Congratulations to all of you on a very, very good and informative presentation. It was very informative and provided sufficient and appropriate information for people to decide whether or not to get vaccinated. And if you missed seeing it live, you can still go to the Bermuda government's Facebook page and view it. I assure you, it will be very informative. Each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, wear a mask, practice good hand hygiene, and maintain physical distancing. And of course, download the We Health Bermuda app. Do the research, talk to your doctor, and make an informed decision about getting the COVID-19 vaccine. Thank you.
Thank you, Minister of Health, and thank you for the work that you and your team are doing. I'm certain that the contact tracers are relieved with reduced workload with less cases, and it's important, as you said, Minister, that Bermuda keeps up the good work as we work to meet our data targets so that we can move on to the next phase. On Sunday, I confirmed that we are currently in phase 1 of 3 on our roadmap to reopening. Combined with the 7-day stay-at-home period, this phase and the regulation within it are envisioned to remain in place for at least the next 3 weeks. I also announced that effective immediately, we would take steps regarding travelers originating from or had visited Brazil, India, or South Africa in the past 14 days, ensuring they will be subject to a mandatory 14-day quarantine and electronic monitoring to ensure compliance. In addition to this, we will also see further changes at our borders, which will be implemented to protect our community from the variants of the coronavirus continuing to originate in other countries. Effective Sunday, May 2nd, all non-immunized travelers entering Bermuda will be required to quarantine for 4 days pending a negative 4-day test. This is in line with the current policy for travelers arriving from the United Kingdom. June 6th will see the implementation of the additional changes at our borders, which has caused much conversation in our community. Effective June 6, all non-immunized travelers, including Bermudians and local residents who travel abroad, will be subject to supervised quarantine for 14 days in a government-designated facility at their own expense. In addition to that, the following changes will occur. The time period for a pre-test required for visitors to obtain a travel authorization will move from 5 days to 3 days, which is in line with the global standard. All non-immunized travelers who are entering Bermuda with a negative pretest will not be required to quarantine after negative arrival tests, but still be required to test on days 4, 8, and 14. And immunized residents entering Bermuda without a negative pretest will be required to quarantine until their day 4 negative test result. In regards to supervised quarantine, we are aware that there are many questions from the community as to how it will impact students returning home, families with children, and how it will function and how much it will cost. The government will provide full details on supervised quarantine on May 6th to give travelers at least 4 weeks notice prior to the changes going into effect. The purpose of this action is to, again, protect our island from the continuing mutations of the coronavirus, which are taking their toll in so many countries around the world. We have experienced the severity of the UK variant ourselves over the past few months. Many would have seen the recent coverage of the double mutation variant, which has had devastating effects on India, with world record cases reported over the last week and their healthcare system teetering on collapse. The scale of that outbreak means there will undoubtedly be more variants that will emerge and that will spread around the world. The government is committed to protecting the health and safety of our country from such variants, and we are committed to getting Bermudians back to work, bringing families back together, and getting our children back into the classroom safely and irreversibly. Stronger protections at our border are necessary so that our island can do what we've said we want to do, and that is to move beyond the pandemic. These actions are not intended to punish anyone. They are put in place to ensure that we can return back to normal life and minimize the risk of having to go backwards, as we've had to do twice over the last 6 months. We are fortunate as an island to have a border that we can control easily, and these new protections are necessary to achieve that aim. By implementing these measures at our borders and with adherence to the current phase 1 regulations, it is hopeful that we can continue to bring down our case numbers and progress to the next phase. As I mentioned on Sunday night, the government will be led by the data in deciding when it's safe to progress. And the criteria that will be considered is a test positivity rate of less than 1%, an average of no more than 7 unlinked locally transmitted cases over a 2-week period, and our 7-day average of our real-time reproductive number must remain below 1. If this criteria is not met, we will not proceed to the next phase. We hope that phase 2 will commence on Sunday, May 9th. This phase will see the end of restrictions on household mixing, as well as the reopening of schools, leisure facilities, churches, gyms, outdoor bars, and dining. Limited personal care services will be permitted. And of course, we know limited personal care services are any services where the mask is able to remain. If a mask is required to be removed, that service will not be able to be provided at that time. It is also envisioned that working from home will no longer be mandatory in phase 2, though it will still be required where practical. Due to our collective desire to eliminate local transmission, there will be continued restrictions on activities. Maximum gathering sizes and a curfew will remain in place during phase 2. The details on these measures will be provided prior to implementation. And the government will continue to provide financial support to businesses and individuals who are affected by these restrictions. As with phase 1, it is envisioned that phase 2 will last for at least 4 weeks, moving to phase 3 that will be data-led. The government will consider specific criteria at that point, which will be a lower test positivity rate, lower transmission case rate, and a lower real-time reproductive number. And it's hoped that we will be able to meet those measures during phase 2. If the relevant criteria is met, our aim is to begin phase 3 on June 6th. And phase 3 will allow for the reopening of all other businesses which were not open in the previous phases. And the government will also review at that time the need to continue the curfew and also the specific restrictions that may be applicable on group sizes, depending on what our situation on the ground is at that time. There's been a lot of discussion about vaccinations, and the government maintains its position that whether or not you wish to get vaccinated is a personal choice. We ask persons to speak to their doctor, refer to credible information, and then make an informed choice. We will continue to encourage you to do that, and if you choose not to be vaccinated, that is your right. I'm encouraged that 50% of our population have received at least one shot, which equates to 60% of our eligible population, and those are the people over the age of 16. This means that 6 in 10 residents who are eligible to be vaccinated have chosen to do so. We will continue our outreach regarding vaccinations, and we welcome you to register today at Bermuda College or attend the register today at gov.bm or attend the walk-in vaccination center at Bermuda College or our close-to-home vaccinations, which are taking place, the Minister of Health announced this week, Thursday at Southampton Princess, or Sunday this week at the Transport Control Department. Vaccinations protect yourself and others, and in particular, help to protect those in our community who cannot be vaccinated and are reliant on community protection to keep them safe from the coronavirus. Whether or not you choose to be vaccinated, I remind all of Bermuda that we have a significant role to play in order to see the end of restrictions in our daily lives. And though we may not always agree on how we get there, we do agree that we want to get there. What can you do yourself? Please get tested. As the Minister of Health said, it is free and easily accessible to anyone who wants it and needs it. And there is no wait for testing in Bermuda. If you're able to go to work, we recommend that you get tested to protect your family and to protect your coworkers. And testing is no longer uncomfortable or intrusive, with various types of testing available every day at either end of the island. Employers, ensure that your workplace is safe by encouraging your staff to be tested. Everyone should download the WeHealth app. It's free, it runs in the background, and can anonymously alert you of a potential exposure. For those who have been vaccinated, as we said, speak to your doctor to discuss if it is right for you. And finally, for those of you who do not support vaccinations, you have an important role to play as well. Please make sure that you follow the public health guidelines, which many persons who question issues going with the vaccines have said are essential to make sure that we stop this outbreak. Please follow the public health guidelines to ensure that you are not contributing to the spread. Get tested on a regular basis and do what you can to boost your own immune system. We cannot end the restrictions unless we end local transmission. And though vaccinations will help us, it is important that those who choose not to get vaccinations do their part to assist the country in observing the guidelines. As I mentioned before, the government will continue to support those who cannot work due to mandatory closures and quarantine. Those persons can go to uba.gov.bm to apply for the unemployment benefit if they have not already done so. Support for affected businesses also remains in place through the Bermuda Economic Development Corporation. Those who require support can go online to bedc.bm to apply for the updated COVID-19 emergency grants. It's important to recognize that grants are available for overheads for businesses, and that is important because there's been lots of discussion about loans that are being extended. If you are a business that is affected by closures, the BDC is giving grants to cover your overheads, such as rent, overheads for health insurance for your employees, electricity that your business will still have to run to make sure that you might have not attract mold if you need to run your AC, and other things such as that. As I close, I echo the minister's words that we are indeed our brothers and sisters keeper. Bermuda is stronger together, and even when faced with the challenges of a global pandemic, we have shown our collective strength and courage. We are a community and a country that will continue to move forward as long as we remain united. And with that, I'm welcome to answer any questions that any member of the media may have on behalf of the people we serve.
Premier, we'll start with Earl Basden from Island Stats. Earl Basden, you're live. Please ask your question.
Good evening, everyone. Can someone explain the 14-day test, the positive test after someone has traveled? Why would it be classified as imported when a person would have been out in the community after at least 8 days?
From an epidemiological perspective, Earl, there are certain calculations that we follow, the WHO in particular, as well as Public Health England. And if it's during the cycle in which is the 14 days is an incubation cycle, if it's within that particular incubation cycle, then it is classified as an imported case. It's simply, we're just being consistent with WHO's recommendations.
Okay. All right, Mr. Premier, just like back on December 2nd, 2016, people were not happy with the then government making the airport deal because of several reasons. What do you have to say to the people who feel like that now with the COVID restrictions in place by your government?
I will say that it's difficult to govern, but we are guided by science and we're guided by getting ourselves to a place where we can move beyond the pandemic. That is all the government is committed to do. Leadership is difficult, but that is what our commitment is.
Okay, we're now looking at yet another major local sporting event, possibly having to cancel because of the restrictions in place on locals. What do the local sporting bodies have to do to get the same treatment as the Bermuda Golf Championship, World Tans, Rugby, Gold Cup, and SailGP?
I think that that's an unfair question, Earl, and I understand what you're trying to say, but we also should remember that last year we had cricket. Earlier this year, we gave permission for football and others. So it's not a question of local versus external. Right now, we have a situation where we are making sure that we are getting local transmission under control. We're working with the BFA to make sure our Olympic athletes are training. We're going through all types of things to ensure that we can accommodate every person who wants to be accommodated. The fact is that we have the regulations that are in place. The Minister of National Security will be speaking to large group exemptions and the matters which have to be done with that. Those matters were discussed in cabinet today, but we're going to go forward. And so there were many sporting events. You're talking about the Bermuda Championship and you're talking about World Rugby Tens. There was also football games and things that we attended at that time as well, Earl. So let's not try to, create the friction where there is none there. Things are done at the time of when there is done. And so at the same point in time that we had the Bermuda Championship, at the same time that we had Bermuda Championship, at the same time we had World Rugby Tens, was the same time that I was celebrating the Devonshire Cougars winning the Dudley Eve Cup. So we do have sporting events. They were all taking place last year. There are different times and circumstances. Even as difficult as the circumstances earlier this year were, we approved for football to go ahead and restart so they can finish their season. Clearly, they decided not to, and then we recognized that there was also a spike. We also made accommodations so our national football team could train, even though there was an outbreak that was there. And so we made those accommodations. So as I'm saying, Earl, we will continue to make the accommodations which are necessary because we recognize that not only do people want to work, but people also want to play sport.
But we haven't addressed the start of the question, which was we have a local event, a major local event about to be having to be canceled because of the restrictions. But we just had another event. Sorry?
I don't know what event you're talking about, Earl.
The Bermuda Day Half Marathon.
Oh, I wasn't aware that's supposed to be canceled. I have no idea why it would.
I'm just saying it's on the verge with the restrictions in place. How would they be able to have it?
Earl, that's the first I'm hearing that is at risk, and I will ask my constituent who runs that event to reach out to me. I don't believe that was a question of cancellation. So clearly, you know things that I don't.
Well, I'm just going by what's out there as far as the restrictions that are out that we're faced right now, that there's a possibility that they won't be able to have that event. I mean, you guys have already, well, the government has postponed or canceled the parade stuff due to the restrictions. Isn't that correct?
Sorry, I didn't hear the question. My children are outside making noise.
Okay, no worries. The parade has been canceled due to the restrictions.
I think that announcement was made as what's going to be done for Bermuda Day. So I don't think that's changed, Earl. I'm sorry.
What's that the parade has been canceled?
No, that there was going to be an event at the National Sports Center.
Oh, I haven't heard that.
That was announced over a month ago.
Oh, okay. It didn't have, well, okay, so, all right, if that's the case, that's happening at the sports center. Okay, all right, we'll look out for that. My final question would be, what is the plan for anyone under the age of 16 that may be coming for a sport or just returning from school? Are the parents or the sporting body on the hook for something that is a law that persons under the age of 16 are not to be vaccinated?
As I had indicated in my comments, we'll be releasing full details on supervised quarantine and the items around there on May 6th.
So they will still have to be quarantined?
That's not what I said, Earl. I said we'll be releasing full details on May 6th.
Thank you very much, Earl Baston. Premier, we'll now go to Media Maya. Premier Minister, I neglected to add, each media has 4 questions for today. Media Maya. Media Maya, you're live. Please ask your question.
Good evening, everyone. Maya Palacio here for Media Maya. My first question goes to either Dr. Miller or Minister Kim Wilson. When will the government allow people to have a choice to access ivermectin as a treatment for COVID-19 freely? As a community member said, some medical doctors are refusing to give it.
Good afternoon. In terms of doctors or patients having ivermectin, it's not really a simple matter. There are complicated issues. The first part, which must be stated with clarity, is that at the present time, neither the WHO, the CDC, Public Health England, nor any of the recognized bodies recommend ivermectin as part of the recognized treatment. Our partner hospital, Johns Hopkins, which many Bermudans go, and we have great respect and admiration for their expertise, they do not recommend it either. As a matter of fact, we had a very good conference on the web on Saturday while it was beautiful sunshine and others were out enjoying themselves. A host of us joined with the folks from Johns Hopkins to discuss a whole range of issues. Most central was COVID, the updates on the treatment, the challenges around testing, the challenges around vaccination. The current situation is that ivermectin is a drug that has been used for the treatment of certain diseases, particularly worm infestation that cause river blindness. That is seen in some parts of Africa, and it has been used, but not in those high doses, nor on a regular basis. For instance, I had a conversation with the CMO who has significant experience using that, but not as a drug for COVID because it's not recommended by any of the agencies. Now, having said that, there are people who believe that it is useful in the treatment. There are small studies rather than large randomized control studies, which would be the standard, or even better, when you have a whole set of studies that can be analyzed in a particular way. So it is not at this point in time that there is a refusal in terms of allowing people to prescribe the medication, but it is a case of really warning doctors and the public that, look, this medication is not indicated nor recommended by these professional bodies. And therefore, if the patient were to choose to use it, they're doing so at their own risk. And the doctor has to explain that. And there is concern that in some instances, it is thought that this is a wonder drug that will cure the patient. And that's far from it. There are very serious side effects. Some people can go into a coma after having it. Others may have seizures. Others may have swelling of the joints and the limbs. Others may have bleeding problems. And there are serious interactions. To a lot of our people will be taking a medication called warfarin, which is a blood thinner. And if you're on that blood thinner, certainly you will get adverse interaction with that medication. So the position is that certainly here at BHP, it is not part of our formulary because it is not recommended by any of the particular bodies. Notwithstanding that, we recognize what we will consider shared decision-making, and therefore we have a mechanism whereby if it is prescribed and there is full disclosure and the patient is willing to sign a waiver, which clearly outlines all the known risks, then under those circumstances, they can have it. So there's not a complete ban, but there is a strict warning. And I cannot emphasize enough that it is not a wonder drug for COVID. It is not curative. And in terms of the recommendation, none of the recognized bodies recommend it at this time. Having said that, there are some trials which are going on. They're not conclusive. And when those trials are complete, they may shed further light on the matter.
All right, thank you very much. I'll be sure to rewatch that Saturday interview then. Thank you for the information. My next question goes to Minister Wilson. In terms of a healthy lifestyle, what measures has the government taken to encourage persons to either eat fresh, get exercise, or get fresh air, or any other natural daily benefits that are proven to boost someone's immune system?
Thank you, Maya, for that. In fact, we just announced a interdepartmental governmental program with respect to wellness, and departments competed against each other with respect to steps and so forth. Unfortunately, the Department of Health didn't win this year, but it's probably principally because we've been in our office for the last 16 months. But needless to say, through the government, we have a number of wellness initiatives that are advanced to encourage certainly members of the public, but in particular civil servants, to exercise and to take care of themselves physically, mentally, and spiritually. In addition to that, you would note that we still have the omnibus surveys that we conduct on a regular basis to just get a measurement of where people are and where they feel with respect to their healthy lifestyle choices, whether it be diet, exercise, and the like. So we continue to monitor that through proper surveillance with respect to those surveys. And the results of those surveys is what we use to help to promote and develop further initiatives based on what we're finding.
Is there a particular initiative that you guys are using right now?
The wellness one that was just announced, I think it was actually TCD that won, but there's, like I said, governmental initiatives so that we have interdepartmental wellness competitions to try to encourage people to continue movement and exercising and taking care of their own body and physical well-being.
Thank you for that. I do want to bring up that some people in the community do feel like the vaccine is being pushed a lot more than healthy living. What do you say to that?
I think that both of them should be operating in tandem. We've heard from the science that, we certainly see the benefits of immunization. However, we also recognize that it is certainly a matter of choice and that we encourage persons to do their own research, speak to their physician, utilize credible resources for making a decision for themselves as to whether or not they should become immunized. But likewise, on the other hand, we also still encourage exercise, getting vitamin D through the sunshine, and taking good care of yourself. Hopefully, in the next couple of weeks, we will be able to see further businesses open, which includes gyms and other health facilities, so that people can continue their exercise regime.
All right, thank you very much. My
You're
next question is for Mr. Premier. Now, I know you said that there'll be more details coming out on May 6th. So this might either be a question you can answer, and I'll be grateful. If not, then it'll just be a consideration for the details when you release them. But the question is from a community member about how much money and where will the to-be quarantine be? And then what is the consideration for returning students who cannot afford this and cannot get vaccinated yet? The UK are only just accepting those over the age of 40. So a lot of people in their early 20s are nowhere near to be able to get vaccinated. And plus they have to wait 3 months between their first and second shot.
Thank you, Maya. I know that there are significant questions around this. And as I'd said inside of my statement, that we'll be making a full announcement on May 6th on all the various matters, and people have asked a number of questions. Some of these things have already been decided, others will not, but we're going to release them all at one time. And so I know there's questions regarding students and families with children, and others, as I said, will release full details of the supervised quarantine on May 6th to give travelers at least 4 weeks notice prior to the changes going into effect.
Thank you very much. My fifth question.
No, I'm sorry, Maya, everybody's got 4 questions today. Thank you very much for your questions. Premier, we will now go to the Royal Gazette. And Royal Gazette's just coming online. Royal Gazette, you're live. Please ask your questions.
Okay. Sorry, Aderonga. I'm having technical issues again.
Okay, go ahead.
I'm here now. Sorry, thank you. Yes, good evening, Mr. Premier. So regarding vaccination rates, you say that 37% of the population have now had 2 vaccines. Does that mean that you're now going to have to amend the expectation that you'll have reached herd immunity by the end of May? That's 70%. Do you think that's a realistic target?
I think what's important to note is that we've always maintained that we would like to get as many persons immunized as possible. We also maintain that our objective and our goal would be to reach close to herd immunity by the end of May, because that would have allowed us to utilize the Pfizer, which would have represented approximately 61% of the population. As you know, now we do now have the AstraZeneca as well, but the reality is that we will continue with our objective of getting as many people that wish to, everybody that wishes to be immunized, there are sufficient supplies available for them. So if you wish to roll up your sleeve and become immunized, you'll be able to have the vaccination.
But it would seem that people aren't willing to get vaccinated, are they? I mean, it seems as if vaccination rates have flatlined. Last week we had, it was 34% of the population which had 2 vaccines. So it's gone up by a couple of percent in the course of a week. I think the week before that it was 32%.
Gareth, I will take issue with what you said. And I know that there's certain persons in the media, especially a very unhelpful cartoon that was run by your newspaper, which one of my constituents sent to me, which said this whole issue of, people who don't take the vaccine are idiots or something along those lines. It's not helpful. And as I had said in my national address, on Sunday, we're trying to bring this country together, and we're trying to focus on what our objective is. Our objective is the work to eliminate local transmission and to ensure that we can secure our borders against the reintroduction of any additional variants to our shores so that we can move beyond the pandemic. 6 in 10 of the people eligible in this country have taken the vaccine. There were people who were turned away from vaccination centers on Sunday who went there to get them and had to come back another day. There are more and more people who are electing to do so, and that will continue. We are going to focus. We are taking these things, we are taking them into the community. We are reminding people, and we're going to continue to educate people. But here's the key point. If we eliminate local transmission, we will be able to move beyond our period of restrictions. Vaccinations will certainly help that point. And I'm confident that eventually we will get to that point. We have the ability to deliver the amount of vaccinations that get us to the 70%, and we will continue along the lines of making sure that people are available. Remember, we have the 7th highest vaccination rate in the world. 6 in 10 adults have already elected. People are getting more and more every day. And so while some may want to focus on whatever statistics to say whatever, what I'm saying is that we as a country need to make sure that we are united in our goal to eliminate local transmission. More and more people are there. Week before last, we delivered our record number of doses in a particular week because we took the week and stay at home to expand our capacity, and we're going to continue to deliver the vaccines. And I think when you're focusing on week 1 or 1 shot versus 2 shots, you'll see that the 2-shot number will go up quicker because there are more people who got their 1 shots and they have to wait 3 weeks. So we're looking at the total amount of people who have gone in, and 6 in 10 of the people who are eligible have. That is great progress, and that will continue to increase over time. That we're confident of. We saw the rush that happened this weekend, continuing education. People will choose not to, but we will get to the point where vaccinations will assist us in reducing local transmission, keeping a lid on local transmission, and combined with our protections at the border, which is key and critical to keep new variants out, that we can get to a place. And Gareth, what's important to know is that there are certain countries that eliminated local transmission before vaccines were even made.
Okay, Premier, thank you so much. Minister, as on the subject of vaccinations, how much of the supply do we still have left, and what's the sell-by date? And is there a risk that we'll have thousands of vaccines in stock that are going to have to be discarded because people haven't been taking them?
Gareth, I don't have that number in front of me right now insofar as how many doses of the Pfizer and the AstraZeneca remain. Again, as I said previously, I think what's more important is the fact that there are sufficient supplies for every person in Bermuda that wishes to be immunized. Government is supplying them, we've provided the opportunities, and we're making them available to each and every resident that wishes to avail themselves of the vaccination.
And the one thing I'll add on that, Gareth, is that the United Kingdom has been incredibly generous as large countries are able to negotiate. And we've been assured that if we require more, they will be supplied. So we're not worried on the issue of supply. We are going to continue to go through this matter. And I'm pleased that more and more persons are electing to speak to their doctors and to get vaccinated. And I'm gratified that the work of the hospital and Bermuda Hospitals Board with their vaccination centers and the increasing numbers of which they have amongst them and their staff, with the community work that's taking place in the Ministry of Health, where we went down to the East End and there were people who were unsheltered, who were able to get their vaccinations as well. We're taking these things to the community to ensure that persons who don't have access to computers, who cannot register online, are not missing out. And that's what is necessary. And this government is committed to doing that, providing that opportunity. And I would hope that the Royal Gazette would cease and desist from such divisive things like that in the newspaper. There's been enough division in this country. And what we want to do is commit to the goal of eliminating local transmission so that we can move ahead.
Okay, thank you, Premier. Are you aware of a petition that's been circulated? It's got about 2,500 signatures at the moment, I believe. And the petition is basically saying that people who don't get vaccinated shouldn't be discriminated against. They shouldn't have to sort of suffer sort of, have things like go through mandatory quarantine in a government location if they come in from overseas. Are you aware of the petition?
Gareth, I am certainly aware of the petition that is circulating. And the only comments of which I'd make to that is that governing requires tough decisions. And I think what everyone in this country knows and recognizes that we must move past this pandemic. We do not want to be in a merry-go-round. The hospitals board doesn't want to be overburdened. The Minister of Health and I want to move on to governing. She wants to move on to reforming our healthcare system to make it more fair, accessible, and move towards our goal of universal healthcare inside this country. I want to make sure that I can redevote my energies and attentions to things of which we were elected on to deliver on October 1st. But right now, the government's energies and attentions are focused into the pandemic. Supervised quarantine is not something that is comfortable. And there's been so many people who said so many different things. But the fact is, we are trying to make sure that we completely minimize the risk for the reintroduction of new variants. And that is the basis on which the government is working towards. And there's many people who have said, what about quarantine at home, all the rest? All of these things were discussed. And as I've said, 95% of the people may, participate. It's the 5% that don't. It only takes one. Look at where we are. It only takes one. And when there's questions about home quarantine, etc., someone can be at home. You might be able to put an ankle bracelet on them, as some people have suggested, but that doesn't stop other people from coming into their homes. That doesn't stop the possibility that they can spread. These are difficult issues. What we are trying to do is our absolute best to make sure that we can move past the pandemic and not have to go back on this merry-go-round of restrictions. So I accept the fact that there's a petition circulated. I accept the fact that people are upset at the moves the government has put into place. There's never been a decision that is made by any government in the world that enjoys universal and 100% support. Our mission and our mantra has always been the needs of the many outweigh the needs of the few or the one, and we have to focus on our community. Because I know there are many parents at home who are, I wouldn't say tired of their children, but would prefer to not have to try to work while at the same time trying to homeschool their young ones. I know that there are many grandparents who want to see their children and who want to spend that time. I know there's many small business owners that want to return back to work and don't want to have to worry about, do I have to save up money because there might be another outbreak in a few months and that the government acts to shut back down again. I don't want to have those discussions anymore. This government doesn't want to have these discussions anymore. We did well last year. We have to adjust our strategy. We are adjusting our strategy. We're going to move forward. So I want people to go ahead and express their concern. I want people to go ahead and make sure they can be constructive in their criticism so we can possibly look at things. They may adjust, but the government did not rush into this decision. There was lots of thoughts around this, and the overwhelming objective was to get us to a point where we do not have to go back again. And that's where we are directed. And we will look at it And if there's more change that has to be made, then more changes and adjustments will be made. But it is essential that we move past it. So I recognize people's concerns. I get it entirely, but we are trying to move past the pandemic.
Thank you, Premier. That was the last question from the World Gazette. We are now going to TNN. And TNN is coming into the room. TNN, you're live. Please ask your question.
Good day, good day. Let me adjust my camera here. Good afternoon. Thank you. Can you see me?
Yes, we can see you and we can hear you. Please
Okay.
go.
I'm opening with a statement. I need some understanding on the reason why we are going from unlimited questions to 6 and now 4. The inconsistency of us, the media, being limited to questions that the public is looking for. The public sends me many questions, Premier Minister, and we are being stagnated. Can this be rectified?
Trevor,
my friend, that's just a statement. It's not a question.
you said, can this be rectified? So we'll call it a question, but go right ahead, Trevor.
Thank you very much. My first question, Premier. The CDC just announced today that people who have had complete vaccinations can be now allowed outdoors without masks. Is this something the Bermuda government will follow?
I think the CMO has joined us, and I know the Minister of Health might also be prepared, so I'll defer to them.
Thank you, Trevor. We have been following the guidelines from CDC and other jurisdictions quite closely. We are in discussions right now with respect to what the next stages will look like, the phases, so to speak, for persons that are totally immunized. We are considering those discussions. However, I think what I would certainly like to, I guess, emphasize is the fact that, you know, it's important for us to keep our focus, and our focus is to minimize the mixing of households. Unfortunately, that has resulted in what we are seeing right now with the most recent outbreaks. I think we need to ensure that we continue to follow the public health guidelines as well. But we are continuing to have those discussions as to what the next phase will look like insofar as further rollbacks of restrictions such as the mask wearing that was announced recently at the CDC. And you would also note that in Bermuda, if you are able to physically distance and you're outside, you are not required to wear masks. So we're very close to where the CDC is as well right now, but we are continuing those discussions.
Thank you, I appreciate that. Let me apologize to my viewers that's given me those many questions to ask. I can't get to them due to the limitations that we are under. My next question, as I sift through these ones, which one do I pick? Premier, I'm not sure if it's you or the health, Dr. Miller. The public is aware some persons arriving at the hospital are showing signs of disease and are tested and are shown to be positive for coronavirus and are being sent home. A, is our health system being stretched to the limits? And B, does the practice of sending these persons home put families and their lives at risk?
Trevor, those are good questions, and I'll answer them for you if I'm permitted. When someone has COVID or COVID symptoms, it does not automatically translate into hospital admission. We only admit the people in hospital who meet certain criteria. In other words, if the person cannot maintain their oxygen saturation, translated in simple terms is that in order for us to survive, we have to have a certain level of oxygen in the blood. The lung does a big job of doing that. Now, there are cases where you have a very bad pneumonia and very bad inflammation within the lung, and that person breathing the normal oxygen in the air would not be able to maintain enough oxygen to survive. that sort of individual then qualified as somebody who we will have to keep in on oxygen support. We may also need to give that individual the steroid dexamethasone, which is very helpful. Now, what happens on the other hand, fortunately, many of the people who are infected with COVID will be asymptomatic. Then there's another group who will have mild symptoms, but when they come to the emergency department, there's a process of assessment. And we have very good doctors, as you know, quite caring, very good nurses and EMTs and the other people. And so they will measure. There are devices that they can measure this oxygen. And in fact, if there is any doubt for further reassurance of the patients, we will oftentimes send them home with a portable one to say, okay, these are the numbers that you look for, because sometimes the person is very anxious, but here are the numbers you look for. If there's a fall to a certain degree, then you come back. Or look, if things get any worse, you have greater difficulty breathing, come back. And we are quite happy to see that individual again and to reassess, because let's, for argument's sake, say we saw somebody 8 p.m. in the night. They went home at 10 o'clock. That person thinks the breathing is worse. We're happy to see him or her again. When we make the assessment and the objective measurement, we may be able to say to the person, well, look, we know you're feeling awful, but your saturations are all right. Your heart function is okay. All the other functions are okay. Here are the things you can do at home. But if there's any deterioration, and we will spell out the particular things to look for, then you come back. In that way, the person is able to go back home. Now the question, the second part, is putting their family at risk. Well, what happens is that if that individual is coming from a particular family, by the time he or she is symptomatic, the family has been exposed already, so the family will be quarantining at home, because it's not the practice here in Bermuda to put everybody into some building far away to quarantine. So wherever possible, we encourage quarantine at home. There are instances when people have particular difficulty doing that. And then there's a discussion involving social work. We may also reach out to the Ministry of Health for assistance, and a solution will be found. But that's the short answer. Not everyone who comes with COVID symptom would require admission.
Thank you, sir. My third question, Premier, this one is from a very large female population in our community. TNN understands that phase 2 goes into effect May the 9th. Premier, and I was told to say it just like this, Premier, May the 9th is Mother's Day. There are many mothers that would like for beauty salons, nail salons, and places so they can get where they can get groomed and present herself on Mother's Day. Is there any consideration for opening up these facilities 2 days prior?
Thank you for the question. It might be something the government would look at, but we're trying to remain focused on our phase plan. We've matched restrictions to come into place based on the EPI week so that we don't have any confusion. Persons who would have listened to the presentation by the wonderful official of the Ministry of Health, Ms. Saiwan DeRosa, who has done an amazing job and puts together all of our health statistics for over a year. It's a pleasure to work with so many amazing public officers. Explained and on the show that we had with Mythbusters that we do things on EPI weeks so that everyone knows and can match it up. So we're now going to do things on weeks that are going on Sunday. So you'll see restrictions are set to go in place on May 2nd, on the border, more changes due for the time of May 9th, and also on June 6th. You recognize that all of those dates are on a Sunday, and that's where we've adjusted our items. It hasn't been adjusted for anything else. The only consideration the government may make is to move phase 2 back because we will just be, I think, about 2 days short of the full 4-week period. So it would be May 11th. It wouldn't be the other way. It's important that we keep these things up. I know lots of people who are involved in the beauty industry. So certainly I recognize that Mother's Day is unquestionably a big day, but the decisions of which we're making are based upon that. The decisions of which we're making are based upon trying to get ourselves to an irreversible path. So I know one of my constituents reached out to me on the exact same topic earlier today, and I made sure that they were aware that we didn't pick the days. It just happened that the 9th was Mother's Day, and I put them inside of my address, but it wasn't picked for that particular day. We're going and focusing on the epi weeks, as people would be aware of from the presentation. And so that's why all of the changes are scheduled to come in place on Sunday, so we can match the epi weeks with reporting of which government does internationally. So that's going to be the policy going forward. But hopefully we will see an end to restrictions and we can eliminate local transmission, so we won't have to worry about that. But I recognize the concern certainly, and that's the view and position of the government.
Good stuff. My last question, this is somewhat of a 3-point pension update, pension withdrawal update, unemployment benefits, which a lot of people have said that they haven't received, and the mobile vaccination, how do I say that? The mobile vaccination update. What is the latest on those 3 points? Thank you for my questions.
Trevor, there is no change in the position of the government at this point in time regarding the pension withdrawals. There was a discussion. The Minister of Finance has said that the pension withdrawals that were in place last year are still there for persons who did not take advantage of them. For persons who are facing imminent eviction and others, they can certainly access their pension because the hardship provisions are there. And there is still the ongoing discussions as to whether or not there will be a second round. But these things are certainly difficult to balance. And so from that perspective, there has been no decision made yet. But the Minister of Finance wanted me to remind members of the public that for the 1-year pension withdrawal is still in place for those persons who did not access it. And there is the hardship provision for education, health expenses, home expenses, et cetera, which still do exist under provisions under law. And there's further examination going as to what, if any, additional secondary benefits may be offered, but it is certainly a difficult situation. The Minister of Health spoke to mobile vaccinations earlier, and I'm happy to know that they are doing well. So thank you for your questions, Ms. Lindsay.
Unemployment benefits update. Some have still not received theirs. And that just came to my phone. Many have not received unemployment benefits.
If those persons haven't received, they know who to contact. It's in the Ministry of Finance, and those persons, there's a very dedicated team that's following up. I also have people who are sending me messages saying, thank you for being so prompt in paying. So if there's individual problems, I will just advise people that the helpline is probably not TNN. The helpline is the government of Bermuda and the Ministry of Finance, so they can follow up on the specific situation. Because the only thing of which we'll say is ask to give the specifics, and then we can make sure that we can follow up. So thank you, Ms. Lindsay.
Thank you. Thank you very much. We'll now go to Bermuda Broadcasting. Bermuda Broadcasting, you are now live. Please ask your question.
Good evening. I'll just try to adjust this slightly. So, Mr. Premier, I understand that you're going to be making the rounds of the media this week and that we're going to have a chance to ask plenty of questions of you on a one-on-one basis. But what was particularly unfair tonight was not knowing that we were going to be limited to 4 questions until after both of your statements. And that was particularly unfair to both Earl and Maya, who were first and second and had to deal with that and scramble to decide what questions they were going to ask. So in the future, if that's going to be limited number to 4 questions, we should be told in advance.
Well, I'll also say this, Don, before you begin. I apologize. That was communicated by my office earlier, and I thought members of the media would have been aware of that. So if that was not the case, that is certainly not in the keeping of which I want. So I apologize on that. I thought that the notification would have been sent earlier, and I wasn't aware that you were not aware until we came on. So I apologize for that.
Thank you. Mr. Premier, the local Bermuda pilots interact with each other, with each of the crews on each of the 3 Bermuda container ships, and is in extremely close quarters for many hours as they accompany the boats in and out of Bermuda. Multiple local pilots have recently tested positive for the coronavirus. Some pilots are currently sick and in quarantine, isolation. Others are being tested. If any of the 40 crew members aboard any of the container ships catch the virus from these infected pilots, the ships will be impounded by the U.S. Coast Guard and quarantined in U.S. waters, which means Bermuda's container ships would be out of service for up to several months. This would immediately reduce supplies of food, medical supplies, and almost every product shipped here. What is government doing right now from a national security and risk perspective to protect the island supply chains? And what is government doing to ensure that COVID-infected pilots stop boarding container ships during the pandemic?
I'm happy to defer to the Minister of Health, the CMO. That's the first I'm hearing of that. Of course, I don't get to know the details of positive cases because Ministry of Health does a very good job of keeping those things confidential. CMO or Minister of Health?
John, I'm afraid there's not much I can add to that. That's information that I'm hearing for the first time as well. I would say that certainly with respect to, as all cases, when a person is identified as positive, then the contact tracing begins. That person is immediately isolated. They're provided with instructions as to how best to preserve or protect the persons that they live with. Likewise, the contact tracers would contact those individuals that would be deemed as close contacts within their particular work environments. So it's not just their home environment, but it's also their work environment. So the same protocols that are in place for any other person that's identified as a positive case would exist for the individuals that you've spoken about. I can't give specifics because I don't know about these particular cases that you're referring to. But as is the case with all persons that are identified as positive, then the whole regime commences with respect to the contact tracing concerning their employment, the persons that they work with, as well as those persons that are home. Instructions are provided with respect to isolation, quarantine, and test, depending on the circumstances of the nature of the close contacts. Any close contact that's identified is required to test. We book a test for them at the Bull's Head car park, and then that process takes care of itself. So it's the exact same process that we use for any other positive case would be in the cases that you've spoken about concerning the crew members.
Yeah, but I'm asking about what are we going to do to protect our supply chain? Because isn't there more of a national importance to making sure that we don't pass on from Bermuda to the ships and then to have the ships quarantined because an infected pilot got up?
I guess the main thing that we can do to help to protect that and preserve that is with respect to education and ensuring that all employers, particularly the ones that are working on the, I guess is that through stevedore services and so forth, to make sure that they recognize what the public health guidelines are. We do quite a lot of education with them. We are available, our team is available to provide them with assistance insofar as how best to protect their employees, just like any other employee employment organization in Bermuda. We are here to provide guidance. That's one of the things that we do from public health, is to provide this requisite guidance so that all employers are aware of what the requirements are to keep themselves safe, as well as their staff members, as well as the continuity of the services, not just the services as it relates to bringing in ships, but also services as it relates to the gas supply, the food supply, and the other services that that are all required and deemed essential in our community for us to survive.
Thank you. Dr. Miller, we understand there are many doctors in Bermuda who are increasingly frustrated with the low vaccine uptake of many of your staff and nurses at the hospital. And there are many patients who don't want to receive treatment in the hospital for the same reasons. We know of one person who's been in the hospital for a serious condition for more than 6 months. And this person got COVID while they were in the hospital, and there's quarantine. So they only could have gotten it from the hospital staff. As chief of staff and as a doctor, how is it acceptable to you that the unvaccinated nurses are allowed to interact and treat patients in the hospital during a pandemic that potentially puts the patient's health at great risk, including unvaccinated minors? You know, can you give us an update on what the vaccine rate is for the nursing staff?
Thank you very much for your question. We'll start with the question of the vaccine rate for nursing staff. If you recall, in a previous conference, I said I would prefer if everybody was up to 100%. And on that occasion, the nursing staff, the registered nurses, were sadly below 50%. Today, I can report to you that based on the latest figures I have, 65% of registered nurses have received at least one dose of the vaccine. 93% of doctors, 93, are completely vaccinated. And whereas we were lagging woefully with the auxiliary staff, we have improved to, we're at 34% there. But in terms of the nursing staff, we have seen a significant uptake, and we're continuing to work with them to encourage more and more to get vaccinated. Unfortunately, it is a voluntary process. We cannot compel, there's no legislation that allows us to do that. And if there was, it probably would not be the way to go. It certainly would be challenged in terms of human rights. So it's a difficult situation, but I must say things are improving. And at the present time, with 93% of the doctors fully immunized and 65% of nurses having the first dose, we're certainly moving in the right direction. And also, if someone were to come into the hospital, chances are that person is more likely to be dealing with someone who is fully immunized. Having said that, part of the trouble we have is that our nurses live in the community, and so it goes to show the problem when there's not enough uptake of the vaccine, because what happens, the unvaccinated put themselves at risk, and they also put others at risk. And another complicating factor is that, as you know, by virtue of the privacy regulations, one cannot insist that a particular individual disclose their vaccination status. Of course, I'm proud to tell you that on the very first day, I made sure that I had my first shot, and the very first opportunity, 3 weeks later, to have the second, I had mine, and also could proudly tell you that there were many other colleagues, doctors and nurses, who were lining up with appropriate social distancing and appropriate observation to have theirs. We continue the program of encouraging people. You may have seen the video that was done on Facebook with Dr. Karika Weldon, Dr. Ayo, Dr. R. Scott, and others. And we've been using little videos like that, corridor conversations, and other methods of persuading more and more staff to take up the vaccine.
Thank you. Mr. Premier, there's been a noticeable change in your tone, or at least it appears to be in recent weeks, with regard to public messaging about the vaccine. At first, government was unequivocal in its message: get the vaccine, it's the best way out of this pandemic. Now the message is a bit softer. It's a personal choice, speak to your doctor. I know you said some of those things earlier, but it seems to be more emphasized right now. Are politics starting to creep in and overtake the science? And that is, are you wary of creating division between the vaccinated and the unvaccinated?
I'm wary of creating division anywhere, Don. And so from that perspective, I think we have to recognize there's been many persons who've said many different things. Bermuda is a country that does not require and or compel vaccinations. We never have. And from the very beginning, I will say in the very first speech that I gave on this issue, it's always a question of to speak to your doctor. And that's the best people who can be advised. It certainly is a personal choice. If you've seen consistency of messaging across all persons from the government, that's certainly a good thing because we want to make sure that we are consistent inside of that messaging. So it's not a question of politics or otherwise, it's the law of the country in which we live. That's the perspective. And so from our case, we want, I'm not the best person to give medical advice. You can trust Dr. Miller or Dr. Io or some other doctor. That's not me. I can speak to my perspective, and as a political leader, I led from the front along with the Minister of Health and others, and with the opposition leader, and went there and said that we are, happy to go ahead and trust the science and going forward. But other people, they make a different choice, and that is completely up to them. We do not force vaccinations for anything in this country, and there's a big debate over that as to whether or not for the challenges of which that poses. But I don't want division anywhere. And so where I want and the objective of the national address was to try to make sure that we include all persons, because we all have a role to play, whether we're individuals, whether we're employers, whether we are persons who choose to get vaccinated or those who don't. Everyone has a role to play in eliminating local transmission. And if we eliminate local transmission, we can end restrictions. That is our goal. If we enhance our protection of the border, we can minimize the risk of the importation of new variants. That is our goal. And that is what the government is going to continue to be focused on as we advance.
Thank you. Dr. Miller, you just quoted earlier in this press conference the WHO as a medical authority, and the WHO is not recommending ivermectin. However, the WHO also does not recommend using remdesivir either, and yet the Bermuda Hospital is still using remdesivir as a treatment. The FDA also gave emergency use authorization for monoclonal antibodies, but apparently the BHB doesn't offer this in Bermuda. Furthermore, there are many governments and health organizations around the world using ivermectin in the treatment of COVID-19. There are now dozens and dozens of randomized control studies and control trials, and there are meta-analyses out there on ivermectin. Have you had a chance to review these studies?
I've certainly looked at a number of things, and there are technical flaws. And so there are better studies that are being conducted, and as I mentioned earlier, included by the WHO. It is true that ivermectin has been used throughout much of Africa, but not for COVID. It was used for the treatment of river blindness and diseases of that sort caused by certain types of tapeworm. And in that sort of thing, and Dr. Ayo is here, he can also verify, in those cases, you were not giving such massive doses. And in some instances, it was being given once per year. So in this particular case, to say, oh, it's perfectly all right, we don't have the evidence. And it's important that, as I mentioned earlier, Johns Hopkins, which is one of the partner institutions that we send our patients, and many Bermudans, if they're sick, that's one of the places that they will go for treatment. They do not recommend it. In fact, it is not recommended by anybody at Oxford. It's not recommended at the Westminster. It's not recommended at the Royal Free. So none of the top UK or US hospitals recommend it as part of the treatment. Now, having said that, you also raise a question of remdesivir. Remdesivir is something that didn't quite live up to promise. And that's a very good question, Don, because sometimes things don't live up to promise. Remdesivir is still used. It is now the general consensus that it probably shortens the length of stay in hospital by a day, but it doesn't cure the patient. So your best thing is get vaccinated so you don't get serious disease. Don't take the risk and think that remdesivir or ivermectin or those agents will save you. But the problem, we don't want people to go down the chloroquine route of thinking that remdesivir is a panacea. Running the risk, you can get very serious liver damage with it. People can get seizures, they can go into coma, they can develop intestinal bleeding. There are a whole range of very serious complications that you may see with ivermectin. And therefore, I would urge caution instead of people seeking to promote it. Here at VHB,
We've got at least 2 doctors here in Bermuda that are promoting ivermectin. And they feel
yes,
like
that is indeed true. And I'm aware of it. And I've had a conversation with one of them early this morning. Sometimes we don't always see eye to eye. And the position here at VHB is that if there's adequate warning, then, and the patient signs a waiver, and that waiver means that they're not going to then turn around and say, oh, you shouldn't have allowed it. If they sign a waiver, then under certain circumstances, they may have it. But it is very clear, I wish to emphasize, we're not promoting it as a recognized modality of treatment because none of the colleges recognizes it, none of the colleges for infectious diseases. The people who we have working in the intensive care department, they're very good men and women, dedicated, they work long hours, and they want the best for their patients. There's absolutely no doubt about it. I met Monday morning, very bright and early, and I called the chief from his other duties to have a meeting with him. I called the chief of medicine, and he's also an expert in infectious diseases. And we consult with others locally and abroad, and we discuss the issues. But the real fact is that ivermectin is not part of the recommended treatment at this time. At best, it would have an experimental status. And if somebody was to say to a patient, look, there's this thing that is being used someplace else, it is experimental, it carries grave risk, here is a whole laundry list of risks. Are you willing to take the risk that this thing could contribute to your death? Because that's one of the things. And if the person under those circumstances in clear mind were to sign a waiver, then they can have it.
All right, thank you.
Can I come in?
Very much tonight.
Can I come in?
Sure.
Don?
Yeah, I'm still
Oh,
here.
hi. Hi. I think it's important that I rightly given frontline patient care view of what needs to happen. But I can give a population view. And because I'm very familiar with this drug, my first master's in epidemiology was evaluating the impact of this drug on river blindness prevention programs. I'm very familiar with the drug. I use it a lot. So I'm extremely familiar with it. When in April 2020, a paper came out in the virology journal saying that this ivermectin was active against the virus in the lab, so in petri dishes outside the body. I was excited because this is a drug I was used to, I was familiar with. I thought, well, this is something that could actually make a game changer. But reading between the lines and finding out more about the paper, actually the plasma, the concentration of drug required to kill the viruses was 4,000 times what we would normally give to people. 4,000 times more. Now, as Dr. Miller has pointed out, there has been a lot of trials that has happened, most of them very, very small and tiny, with so many confounders that you cannot really make a lot of inference from that. And there's almost there's as many papers as you have that supports it, that those that didn't support it. One thing that is clear, putting all that in those data together, is that the papers that show that they support it, many of them have flaws because they're not properly controlled for other things like use of steroids, and also the size of the sample that we looked at. The way science works is that randomized control trials are the gold standard, but even beyond that, especially when you have small studies, you need to pull everything together. And based on the pooled effect, you can then say, actually, if we pretended as if all of this was one randomized control trial, what is this telling us? And it's on that basis that none of your august bodies, not WHO, not FDA, not MRHA, not any of the, not the European Medicines Authority, are recommending this. It's not, the effect does not just exist. Now, you mentioned that some doctors are using that for Ireland. That's perfectly within their right to do that as independent medical practitioners. You are allowed to use drugs outside its license. However, the responsibility for that lies with the prescribing physician because you are using it outside the license established. It's also important to note that the manufacturer of this drug, Merck, does not and clearly states that this drug is not indicated for treating COVID-19. So if people choose to use this, as Dr. Miller said, it needs to be seen from the point of view that the evidence, the sum total of the evidence does not support this. As Dr. Miller also said, at the moment, there are ongoing big trials that's pulling everything together that will give us information in the future. It's not, at this stage, there's just not enough evidence to support it. Thank you.
Okay, thank you very much.
Thank you very much, Don. Premier, there are no further questions.
Thank you very much. Just as a response to what Don had said at the very beginning, and thank you, Madam Director, because it didn't seem to make a lot of sense that the media was not involved ahead, and thank you for forwarding the email that you sent to all members of the media with a Zoom link for this press conference, in which it said, "Good day, media. When you join, you'll be in the waiting room and not let into press conference. So it's your turn. Please turn on your camera to ask questions. Indicate who you're directing your question to, Premier or Minister. You will have 4 questions each today in bold. Once you're asked your questions, please leave the meeting," and you gave the order of questions for this evening. So it was communicated to members of the media in advance in the same email of which the Zoom link was included to enter this meeting. I will say this as I close, certainly that the purpose of these press conferences is to provide information to the public on the coronavirus. The decision to reduce the questions was mine, and it was based on the feedback that I received from the public. Coronavirus press conferences are serious matters, and many people felt they were not being treated seriously. I would hope that members of the media will respect the serious nature of this virus, the pain that it's caused for so many different families, and the work of which so many officers of the government and in the private sector, such as our doctors and others, have done to battle this particular pandemic. And I sincerely hope in that vein that members of the media will carefully choose the 4 questions at which they wish to put forward. What I will always remind members of the public is that you are welcome to address your questions to the government through the respective government agency or myself at premier@gov.bm. And if there's any members of the media who did not get to ask any questions they want to ask this evening, they're welcome to send them to the Department of Communications. And I know all members of the media know how to follow up with the Department of Communications and or the director. So with that, it is an absolute pleasure. I ask all persons to please make sure to remember to follow the public health guidelines. We'll be with you next week for another coronavirus press conference. So thank you Bermuda, and good